Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. As you are aware, this is a talk show with expert doctors of Al Hilal hospitals and medical centers. Today we will be discussing about a topic that affects people of all ages, tooth decay or dental caries. And the doctor joining us today is Dr. Nishya Shelby from Al Hilal Hospital, Sitra branch. She is a general dentist with an experience of more than 15 years. So, doctor, welcome to the show.
Thank you. Thank you for having me. Nice to meet you.
It's a pleasure, doctor. So, doctor, what exactly is tooth decay and how does it start?
Okay. Tooth decay or dental caries is a microbial disease. That means it's a bacterial disease affecting the oral cavity, which affects on the teeth, and it causes cavitation, pain and infection. So if you know how the caries occurs, it's very easy to prevent. So when we eat food, the bacteria present in our oral cavity feed on this food particle and form a thin layer which gets stick to the teeth. That is, we call it as plaque. So in this plaque, the bacteria start producing acid, which cause erosion of the enamel and demineralizes the enamel. That is the first layer of the teeth. This is how the cavity starts.
So, doctor, how common is tooth decay and who are at risk of this condition?
Actually, dental caries is a very common oral health issues which we can see in every age or every gender. But some people are very prone for dental caries. Especially the children and the teenagers because of their food habits, and those who don't brush daily or brush or floss properly, they are very prone for dental caries. Those frequent eaters, like those who snip or snacks frequently, they are very prone for dental caries. And even in the older age, why? Because they have very weak periodontium or very weak gum, which can cause gum recession, and the roots will be exposed and they are very prone for the root caries. And the people having dry mouth with less salivation, they are also very prone for dental caries. And people having some health conditions like diabetes, acid reflux because of the acid production in your mouth, and people having physical impairment, that we are very difficult to clean their mouth, they cannot do that by themselves, so they are also very prone for dental caries.
Now, can you explain what happens to the tooth as the decay progresses?
So, actually, dental caries is a very slow process, but if you take care of in the initial stage, it's easily reversible. So, there are many stages. In the initial stage, as I said, the bacteria start producing acid and it start eroding the enamel. This is the initial stage. So, after this bacteria reaches the next layer, that is a dentin. It start cavitation. Then we can see the hole in the cavity. So after the dentin, that reaches the next layer, that is pulp, where we have pain and infection, and in the final stage it causes abscess. This is the stages of dental caries.
So, doctor, what are the main causes of this tooth decay?
The common cause for dental caries is the food habit itself. Those who people are eating too much of sugary or sweet drinks or carbonated drinks, it is one of the most common cause of dental caries. And another is poor oral hygiene. So those who don't brush or floss regularly, it can cause cavitation to the teeth. And some are health conditions like diabetes, acid reflux, and even the cancer patient, those who are after the radiation therapy, because of the less salivation, it also can cause dental caries. And that's.
Doctor, do you think that heredity plays an important role in dental caries?
Yeah, heredity to an extent it plays a role in dental caries. How it is, hereditary means we are inheriting some features from our parents. So some people can get structure of the teeth from their parents, like the strength of the enamel, the type of bacteria present in your oral cavity, or the position of the teeth. This all can inherit from your parents. So this can eventually can cause dental caries because of the position and the structure.
What are the early signs of tooth decay? We know that pain would be there. Apart from this, what are the signs of tooth decay?
Normally in the initial stages, there is no need that there will be pain. So it starts as a white spot on the teeth. Not everybody think that it's only black, but initially the caries start as a white spot. Then you can see as it progress, it can lead to cavitation like a black spot. Then you will have sensitivity, pain, bad breath because the food accumulates on in the cavity, the bad breath and bad taste and pain. This and abscess or swelling. These are the signs which we can see that this dental caries.
Now, what are the treatment options, doctor, for the dental caries for each stage?
So in the initial, if you detect the caries in the initial stage, it's very easy to treat it. You just need a dental filling. But even before if you detect it earlier, before, like as I said, if you see a white spot, in that stage it is reversible by fluoridation, like fluoride treatment, and you can use pit and fissure sealant. Like it's a thin layer of material which we apply on the back surface of the teeth to remove the roughness of the teeth to make the tooth surface smooth. So fluoride treatment, pit and fissure sealant, and then when it start cavitation, we can go for dental restorations, like we have white color restoration, composite restoration, glass ionomer restorations. But once the caries progress and reaches the next level, we have root canal treatment. So at the final stage, if the tooth is not at all replaceable, it is completely lost, you will have to go for an extraction or tooth removal.
So, when a patient comes to you with tooth decay, how do you decide whether the cavity should be filled or root canal treatment can be done?
Initially, we can decide with the symptom itself, but after a thorough examination, if you find that the cavity is only limited to enamel or dentin, we can do a normal restoration. But if you see in an X-ray, or if you can visualize it, or if you can take an X-ray to check how the cavity has progressed, and if it reaches the pulp layer, that means it has to go for root canal treatment. You cannot do a normal restorations. Okay. And if the teeth is completely lost, then you have to go for extraction.
Doctor, what are the most effective ways to prevent tooth decay?
The most effective way of teeth preventing is oral hygiene habits, like brush twice a daily, and flossing. Flossing is very important because this flossing can remove the plaque which is accumulate on the teeth, and flossing should be done after each meal. Not like at least once in a day you have to floss your teeth, and rinse after every meal. Don't forget to wash your mouth. And another way is visit a dentist every 6 months for an early detection of caries. Dentists can do fluoride treatment, as I said, sealant, pit and fissure sealant. These all are preventive method for caries.
Doctor, we know that tooth decay is very common in kids. So, what can parents do about it?
So, parents should bring their children as soon as the tooth erupts, or not actually as soon as, at least 6 months after the tooth erupts, or every year, just for a checkup. So, this we can find it if there is an initiation of caries, or if there is any abnormalities happening in the mouth or the teeth eruption. So, at this age, we can help them. And what the parents should do is make the child have a habit of rinsing their mouth. Don't limit their food, sugary food and sugary diet, and ask them to brush their teeth every day, especially in the night, and avoid any sweets or any sipping. Like if you have a sipping habit of like juices or milk, avoid that, especially in the night, because prolonged time of sipping of any juices, it can cause cavity, especially in the children, because they have very weak enamel structure. So, if you take care of this oral hygiene habit, we can control the.
And doctor, how often should a person visit a dentist to find out about the tooth decay?
Okay, we recommend every 6 months. Actually, like as I said, caries is a very slow process. You need only to visit every 6 months. So, in the initial stage, if you find out that you have a caries, you have an option, better option, which is less cost effective, and you can do the treatment, or you can prevent the caries. So, every 6 months you should visit dentist. If you have a cavity, if you don't have any symptoms, it's better.
And finally, doctor, what is your advice for our viewers?
My advice for the viewers is, take care of your food habits, brush your teeth twice daily, do a flossing, and in possible visit a dentist every 6 months. So, you can prevent the caries.
Thank you, doctor. Thank you very much.
You're welcome.
So viewers, I hope this was a very informative episode. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time with a new doctor and a new topic, this is Jessila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.